Still in South Africa, the Democratic Alliance in Mpumalanga has called on the government and the National Education, Health and Allied Workers Union to find a common ground as the strike as it affects services in province, especially healthcare. It has been reported that patients in maternity wards of Tonga, Shongwe, and Ferreira hospitals were forced to help others give birth as healthcare workers who are not on strike were denied entrance to those hospitals by members of the Nehawu who were on strike. Now joining me on the news to discuss the impact of the strike is DA spokesperson on health for Mpumalanga province, Jane Sohithile. Thank you for your time.
Thank you very much, and thank you for having me. Thank you.
All right, so let's get to it. How much damage did the strike cause your province?
Look, you cannot quantify the damage in rands and cents, but obviously in terms of people accessing healthcare services, it has caused severe damage. As you know, you would have seen the reports according to what we receive as we do oversights, and also receiving a lot of calls from patients and their families as they are worried when they can't access most health facilities that are currently closed in hospitals like Tonga, Shongwe Hospital, Rob Ferreira Hospital. Patients are helping one another in the maternity ward, even to give birth for those women that are in labor. We've got laundry services that have been brought to a halt, which poses a risk in terms of hygiene in these hospitals, and most of the health facilities are completely shut down. So that is why the impact is way beyond rands and cents as it affects people's lives.
Now, Nehawu says the government owes them more than 13 billion rand, and also, of course, wages increase, which the government did not want to come to the table. Don't you think that this strike will actually was justified looking at the high cost of living currently in the country?
As the Democratic Alliance, we actually support the strike and their right to protest, because our health workers, not only in Mpumalanga, throughout the country, they are working under extremely poor conditions, extremely difficult circumstances, and we believe they are underpaid. However, what we do not support is when it's costing lives, when people are losing their lives because of the strike. You know, while their cause is good, as we are saying, they are protesting for a good cause, because we do believe their salaries must be increased. But however, blocking other people to get access to healthcare, that is not justified. Section 27 of our Constitution guarantees that everyone has got a right to access healthcare services. And that is where we are calling on government to really go back to the table with Nehawu and renegotiate and come to the table and come to the party, because our healthcare workers in our province are indeed underpaid.
Now, workers have been complaining about the state of healthcare and facilities and lack of adequate materials in hospitals, which of course the DA, Democratic Alliance, has also raised concerns on this. How is this affecting working condition in the healthcare sector?
I can tell you, in Mpumalanga, where I work and I regularly frequent hospitals, the situation is dire. The morale is low. Sometimes the doctors and the nurses don't even know what to do. Doctors will fork out money from their pockets to buy like a machine for to test high blood pressure from their own pockets. Some even use their own medical aids to get some of the equipments which should be provided because they are basic. And also when people arrive at a healthcare facility and find that the equipments are not working, they look in the face of the doctors and nurses and they are helpless. So this has got an impact in terms of their day-to-day functioning. Not so long, even lifts at Standard Hospital were not working. Doctors were carrying patients on their backs to go to theatre at second level. Pregnant women were being pushed on the stairs by physical people and carrying them up and down. That cannot be a condition that any health worker would want to find themselves in. So that is something that we've also taken it up with the Human Rights Commission several times. And at the moment, the situation is not improving, unfortunately, it's deteriorating further. So we are with the health workers. We understand their plight because we see it every day that, it hampers their work. The morale is down. They can't function. And they don't know where to turn to when government is not coming to the table to actually assist in such matters where even the equipments that is in the hospitals are not working.
All right. Thank you so much for your time, Jane Sithole. And we hope that this issue is actually resolved as soon as possible.
Thank you very much. Thank you.